continue my head to toe MOT of your baby. So today we are going to talk about all things teething. So let me first begin by saying that some babies are actually born with teeth, and some babies don't get teeth until after their first birthday. And I have seen some babies not get them until they're into toddlerhood. And it's all normal, so don't worry. But generally, you can expect for your baby to start teething in and around 6 months of age. Now, teething can be quite a tricky time because it's quite painful for the child, really. Well, not painful, but it disturbs them and causes an irritation when they are starting to teeth. Now, a lot of parents ask me, how do I know when my baby is teething? Well, there are a few signs that will tell you. Your baby will be unsettled. They may go off their food. They will certainly be drooling quite a lot. They may have a bit of a temperature as well and just be generally off form and not quite themselves. Now, unfortunately, this happens to be mostly during the night because they haven't got really anything else to think about. They're not distracted in the daytime. So that's when things will come to a fore. And it's not what you want at all. But the best way to know whether your child is teething or not is to look at their gums. Now, the way that you will recognize it is that when you visually look at the gum where the tooth is coming up will blister or bubble up. And when you run your finger across the gum line, you will feel the elevation on the gum. This is the best indicator that your baby is starting to cut their first teeth. Now, when they do cut their teeth, they will have pain and discomfort for about 4 days before the tooth actually erupts, and that will continue, sadly, for about 3 days afterwards. So in all, you're looking at about 7 days of discomfort or interrupted sleep for the duration of that tooth coming through the gum. Now, if you're really lucky, they will come through in twos rather than singles. You can expect your baby's teeth to arrive on the lower gum first. Here, the incisors normally start on the bottom, but don't worry if they start to come on the top, and they will be followed by the teeth either side. Now, some parents ask me, is it harder to cut through the canine teeth, these ones? And it's not really. They're all the same, and the premolars are the same as well. Every tooth that erupts through the gum will cause discomfort for your child. Now, teething might go on for some considerable time, as you can imagine, because babies will get 20 milk teeth, so they'll have 10 on the top and 10 on the bottom. What can we do about it? Well, there are several things that we can do about, but mostly it's managing the symptoms and comforting your baby. So if they have got pain or discomfort, or if they have a slight temperature, you can give them infant paracetamol, Calpol, and that works very well. Now, you can give that as prescribed on the bottle 4 to 6 hourly. Now, if you've got a particularly difficult tooth that's cutting through, or your baby seems to just not be managing the pain, you can use ibuprofen or Nurofen in between, but always follow the manufacturer's instructions. I find ibuprofen was better actually because it's an anti-inflammatory as well as pain relief. but paracetamol is an antipyretic, which means that it can bring down the temperature, and it is also an analgesic, so it will help relieve the pain. Now, there are a number of gels and teething paraphernalia that you can get over the counter. Personally, I didn't use those for my children, and there has been some research to say that the lidocaine in these is not what they would recommend it. That was by an American study, but I don't want you to all panic and freak out thinking, oh my gosh, I've been given one gel or whatever to my baby. The research is very small, and we really don't know how significant those findings are. What I used to find was that the traditional methods are the best. So to cool down the gums, I would suggest that you buy teething rings, put them in the freezer, and your baby will really relish just putting the coolness to their mouth. But if you don't have a teething ring, you can use other things. So you could use pieces of apple and put them in the freezer, and they will work equally as well. But also a flannel or a piece of cloth you can put in the freezer, and that works very well on just cooling down the gums. Another little tip I would give you is that a spoon, if you put that in the freezer, that is really quite soothing for your baby as well. Anything cool that's going to bring down the inflammation and something that they can chew on is going to really help them. There are other products on the market like Bicky pegs and things like that, which they can bite down on as well. I don't know, I used to use them, but I didn't think they were great. But every baby has their own different personality, and what works for one won't work for another one. Now, when your baby's teeth do come through, please do make sure that you buy a really soft toothbrush and some baby toothpaste. So it needs to be 1,000 millimeters parts rather of fluoride. Don't ever use adult toothpaste, it's too strong for your baby. And only use a little pea-sized amount on the toothbrush. Don't spread it across the whole of the brush, because you can over-fluoridate the teeth and cause problems with them. Now, it is important that you do use a fluoride toothpaste, because a lot of parts across the country don't fluoridate their water, and it can cause a problem with tooth decay. So it is a fine balance. Now, once your baby's teeth do come through, as well as brushing them, try and keep your sugar content for your babies low. So if you are going to give them sweet things, it's always better to give it to them when they are having their meal, and avoid sugary or salty snacks in between meals, because they can erode the milk teeth and the enamel quite considerably. I would definitely say avoid any juices. Unfortunately, I have seen many babies and toddlers with tooth rot, because they've been given juice in a bottle, and it can just completely erode the teeth here, and many children unfortunately end up losing their milk teeth because of the acid as well as the sugar in these drinks. So if you are going to give your baby some juice, I would always say to water it down. There are a lot of baby juices on the market, but even with those, I used to water them down. And in fact, I used to go for herbal drinks. And there's some really great ones out there that I used to use. Chamomile was a particular nice one that my children used to like, and fennel. Now, it's really important that you get the baby version and not the adult version of them. And I used to find the fennel was a great digestive for my children, and the chamomile really help them to soothe them. So I used to use those herbal ones rather than juices of any kind. So those are the main things that I wanted to talk about with teething. As I said, it can be a really difficult time, and it can affect and disrupt your children's feeding and their sleep pattern. So I hope you got some value out of that today. Oh, just one more thing. Make sure that you register your child with the dentist. A lot of parents ask me, when should I register with a dentist? My best recommendation really is when they have their 2 to 2.5 year developmental check. All 20 teeth should be through by the time that they're 3 years old. But, no time is too early. Some dentists will see your baby earlier than 2 years, others won't. But it's not a bad thing to register early to make sure that your baby has got a registered dentist going forward. So there you have it, all things to do with teething. Good luck with it. Tomorrow I'll be here in my profile page, and I will be talking about diarrhea and vomiting, another very common minor ailment in children. So I will see you then. Until tomorrow, have a really great day and happy parenting. Bye bye, everybody.